Your dog could be in pain right now, and you'd never even know it. No limping, no whining, nothing. They're eating fine, playing fine, tails wagging like everything's totally normal. But here's the wild part. Dogs are straight up experts at hiding it, and one of the sneakiest ways they do it? Something almost every owner has seen and completely missed. Here's a small one to start. Dogs will start chewing on just one side of their mouth, barely noticeable. Most owners never catch it, and that's just sign number one. There's a bigger one coming later, the one even vets say gets missed the most. But first, you need to know why dogs do this in the first place. It's instinct. Dogs are still wired like their wild ancestors, and out there, showing weakness gets you left behind. So animals evolve to mask pain, no matter how bad it gets. Your dog's got a couch and a food bowl now. But that instinct never switched off, and it's worse with their mouth. No matter what hurts, they still gotta eat. So instead of stopping, they just adapt, quietly, and never let on that something's wrong. So here's the rest of what that looks like. None of it seems alarming on its own. That's the trap. Chewing gets a little slower, a little more careful. Sometimes they drop a piece of food, and you just chalk it up to wasn't hungry. Other times it's sneakier. They start picking soft food over crunchy kibble. No explanation, no warning. Then their favorite chew toy, the one they use to destroy in 10 minutes, just sits there now. Their breath gets slightly off, not dramatic, just not right, and every once in a while they paw at their face, which almost every owner writes off as an itch. Dogs don't hand you one big signal, they scatter tiny ones across weeks, sometimes months, and that most missed sign I promised you, it's coming up next, because vets actually catch it in a completely different way than owners do. Here's what a vet's trained to catch. The signs underneath the signs. First, buildup along the gum line. That yellow-brown crust isn't just normal dog teeth, it's tartar. Hardened plaque packed with bacteria, sitting right against the gum, usually the first visible clue something's brewing underneath. Second, red or swollen gums, especially around just one tooth. That localized redness is a real tell. It often points to inflammation building right at that spot, and it's exactly why vets don't just eyeball it, they check it. Third, a slight head tilt while eating. Dogs will subtly angle their head to keep pressure off the side that hurts. Subtle, but once you know to look, you'll catch it. Here's the one that gets missed most. If your dog suddenly gets weird about you touching their mouth, pulling away, stiffening up when they used to be chill about it, that can be a sign of pain, not just attitude. Owners almost always read this as mood. Vets read it as a symptom. Here's the stat that gets people. The American Veterinary Medical Association says by age 3, most dogs are already showing early signs of periodontal disease. Not might develop it someday, already happening, right now, mild or not. This isn't just a brush your dog's teeth issue. Untreated dental disease doesn't just sit in the mouth. It can spread into the jawbone and get seriously painful. And vets are increasingly studying how mouth infections connect to the rest of the body. It's an active area of research, and it's one more reason dental health isn't something to brush off. There's a behavioral side too. Owners will say their dog got grumpier or slowed down with age, when sometimes that dog's dealing with chronic pain nobody ever addressed. It gets labeled as just getting older when it's actually something treatable. That's the real danger, not that dental problems are scary on their own, but that they get missed and mislabeled for months, sometimes years. So what do you actually do with this? First, once a month, gently lift your dog's lip and take a look. No tools needed. You're checking for redness, swelling, or heavy buildup. Second, watch how they chew. If one-sided chewing starts becoming a pattern, that's worth flagging to your vet. Third, do a quick smell check. Some dog breath is normal. Dogs aren't walking around with mints. But a strong, foul smell? That's worth getting checked. It can point to infection. Fourth, get a dental check at your dog's yearly vet visit. And if you've got a small breed, ask about doing it more often, since they're especially prone to this. Checking at home helps you catch red flags early, but a lot of dental disease hides below the gum line where you can't see it. So this monthly check isn't a replacement for the vet, it's how you know when it's time to go. So here's the takeaway. Dogs are wired to hide pain. It's not stubbornness, it's not attitude, it's instinct, which means it's on us to catch the small stuff before it turns into something bigger. Be honest, has your dog done any of these? One-sided chewing, skipping their favorite chew toy, getting weird about you touching their mouth? Drop it in the comments. I guarantee you're not the only one who's seen it and brushed it off. And if you want more videos on the hidden signs your dog's actually sending you, subscribe, because this is just scratching the surface of what dogs don't tell us.